Nasal vaccines are a type of intranasal injection that involves a hormonally based shot, administered through the nose, rather than a standard needle injection. This type of vaccine is used to help protect against a variety of viruses and bacteria, including the flu virus. The shot is usually in the form of a nasal spray, but it can also be administered as a nasal drop or nasal mist. Intranasal vaccines are typically administered using a spray. The spray is composed of either live attenuated viruses or inactive components of a virus and is delivered via the nostril, without the need of a needle. Generally, the shots are usually not painful and the patient usually does not feel any discomfort. It may take a few seconds for the vaccine to take effect. It is common to experience a slight sting or burning sensation when the vaccine is administered, but this is usually short-lived, and the overall experience should not cause the patient any discomfort. In terms of effectiveness, the nasal flu vaccine is very effective, providing protection against the flu virus. It reduces the risk of serious flu complications and is safe for use in children over 2 years old and adults. The nasal flu vaccine has been shown to be highly effective, reducing the risk of contracting the virus by about 70 to 80%. Now let's talk about how intranasal vaccine works. When the vaccine is administered, the patient will breathe in the vaccine, which contains virus particles. These particles are then deposited in the nose and throat and then travel to the lower respiratory tract. Once they reach the lower respiratory tract, they will encounter antibodies within the patient's body, which will protect the patient from getting any harmful infections. The nasal vaccine is usually given to children between the ages of 2 and 8. The vaccine is also recommended for adults over the age of 50 and those who are at high risk for flu complications. Some special guidelines for dosage may be required for younger children. It is important to note that the nasal flu vaccine should not be given to pregnant women or those who are immune compromised. You not get flu from nasal vaccine. Intranasal vaccines do not contain live viruses, so the chance of getting flu from the vaccination is very low. What happens if you inject an intranasal vaccine? Injecting an intranasal vaccine can result in serious side effects such as pain, inflammation, and fever. It is important to speak to your healthcare provider if you experience any of these side effects. Who is high risk for flu vaccine? High-risk groups for flu vaccine include the elderly, young children, pregnant women, and people with chronic health conditions. Talk to your doctor to see if you or your loved ones should receive a flu vaccine. Thank you for watching, and if you would like to learn more tech information, please watch more of our videos.